honor to introduce our facilitator for this evening section, Lydia Jumaingaa. Lydia is a passionate youth development practitioner with a strong focus on digital health, sexual reproductive health, and rights for adolescents and young people with over 5 years of experience. She has made remarkable contributions in advocacy, policy, policy, um, policy development, program design, and management, both in Nigeria and across Africa. Her leadership in SRHR initiatives has ensured that young people have access to comprehensive sexuality education and essential health services. Lydia has also been a key voice on international and global platforms, speaking on issues such as digital transform of SRHR, HIV, interventions, universal health coverage, and meaningful youth engagement. She has worked with reputable organizations, including the UNVPA, UNICAF, African DCC, Digital Transformations for Health Lab, and Younger, offering our expertise in shaping policies and strategies that impact young people. With our wealth of experience, deep commitment, and an innovative approach, Lydia continues to play a vital role in creating a healthier and more inclusive future for adolescents and young people across Africa. Please join me in warmly welcoming Lydia Jumai Gaha. I'm expecting a round of applause and everybody cheering her up because that's quite a resume for somebody huge. And we are happy to have you here to give your wealth of experience to this masterclass. Over to you, ma'am.
Thank you so much, Oluwabukumi, for a flattering introduction. Thank you so much. It's my pleasure to be here as the facilitator for this evening. And I hope that we would have a wonderful engagement. And I hope it's not going to be a boring class because I love my class to be fully engaged. Yeah, so do you want me to share my slide or you would be projecting slide? But before you share the slide, I will be speaking on strategies for working with adolescents to promote safe and healthy sexual behavior. And I would want to assume that we are all healthcare practitioners here, NGO worker, SRHR, advocates, and also who are focusing on promoting and making sure adolescents and young people have access to SRHR information and also services. And before we go further, I would like to take a quick pause to, gauge the room and to see how we are all faring. And I would like to share my screen. Okay. Good. Can you all see my screen?
It's still loading. Okay, yes, now we can see it now.
Oh, okay, you can see my screen. Okay, perfect. Just give me a moment. Okay, so can we all just, bring out our phones and just go to menti.com? Can you see my screen now?
Yes, we can. I can.
Oh, okay, perfect. Just bring out your phone, go to menti.com and use the code 76944158. It's just a quick pause to see to check in how we are all doing, how we're feeling, and maybe some kind of expectations from this workshop. So we can just do that briefly.
You mean menti.com?
Yes, menti.com. It's
Okay.
boldly on the screen, menti.com, and then use the code. So just checking. Yeah, so the code is 76944158, menti.com. Are we there yet? Okay, I'm not getting any
Yes, I'm
response.
there. I'm there. Sorry, I
Oh,
thought my
okay,
mic
okay.
was on.
Oh, okay. So the question is, how are you feeling? I just want to, gauge how we are feeling right now.
Okay, I'm in now.
Okay. Can you see the question?
It says pause check. Please join the Menti using the
I
QR
said
code.
go.
Okay, so you see an arrow which says next, because that's okay. This is the first slide. So has it changed? As the slides changed? Sorry, has it changed on your mobile device?
Yes, that's changed on
Yes.
my own end. I have
Oh, okay,
said my
okay,
response.
okay. Oh, I'm seeing responses. Can you all see the responses as well?
Yes, yes, we can see it
Oh,
here now.
great. Oh, okay, great. I'm fine, better. Oh, this is a nice response. Oh, great. Okay, this is a great response. So let's go to the second slide. It says, what's the one word that comes to mind when you think about adolescence or when you hear the word adolescence? What comes to your mind? What comes to your mind when what's that one word that comes to mind when you hear or think about adolescence? Someone said they are handful. Someone said they are young and agile. Mm-hmm. Okay, please keep the responses coming. Growth. Yes, yes, yes. Okay, let's keep the responses coming. Let's keep it coming. Okay, puberty age, young. Yes, we're all correct. And so let's move on. So the third slide, people have started responding. What challenges do adolescents face regarding SRHR information and services in your community? Someone said smart. Okay. I don't think you responded to this question. These responses, I think it's for the previous slide. But for this slide, what challenges do you think adolescents face regarding accessing SRHR information and services in your community? Okay, someone said stigmatization. I totally agree with you. It's seen as a taboo in some places. Of course, the society sees it as a taboo, especially for young girls. There is little to no information due to religious or societal beliefs. I agree. Ignorance. I totally agree with everything. Lack of comprehensive sexuality education. True, true, true. Okay, misconception due to wrong information. True, when you have the wrong information, you tend to have wrong ideas, and you won't be able, and the adolescent will not be able to make informed or right decision concerning themselves, concerning their health, and also concerning their body. Limited access to youth-friendly health services. I agree with you. Most facilities in the country do not offer youth-friendly health services. And it is important because adolescents are young people. They also have needs, and as healthcare provider, as advocates, we should ensure that these adolescents' needs are being catered for. Digital divide and misinformation. We are all right, and without wasting much of the time, so I think we'll just jump up to the slide. So thank you so much for participating in this short quiz. Okay, so I would just go further to share my slide. Okay, can you all see my screen?
Yes, we can.
Oh, okay, thank you so much. So moving on, like I mentioned, that would all be participating and talking about strategies for working with adolescents and to promote safe and healthy sexual behavior. And from our responses, it shows that all of us in this room, we've had interaction with young people, with adolescents in all their diversity, in providing access and also information to SRHR, and also coming up with interventions to address their need of adolescents and young people. So we've done the pulse check, and okay, so let's move on. It's important for us to understand the people that we are working for, because if you don't even understand what their needs are, it will be difficult to come up with programs and solutions to address the needs of these wonderful young people. And in the other response, someone said that adolescents are a handful, and most of the time it's because of the stage where they are. And if you look at the screen here, who is an adolescent, right? So basically it's a process, it's a stage, it's a phase from childhood to adulthood. It spans from the ages of 10 to 90 years, and everybody in this room, we were once an adolescent. And in the course of this training, I want us to also reflect back, think back when we were in that age. What are the things that we wished we had known, the kind of information we should have gotten, maybe from our teachers, from our parents, from our peers, and from everybody who is around us, right? And to understand adolescent, right, we also need to understand how they develop, right? from the physical development to the emotional development to the cognitive development, how they interact with everybody in their social cycle and all, right? So because from their physical development, like I mentioned, it's a stage from childhood to adulthood. So definitely there are physical changes, hormonal changes, puberty, and curiosity about sexuality in all its entirety, all right? And also as they begin to develop physically and they begin to interact with their friends, their peers, they start having some conversations because they are not curious. They want to explore more. They want to understand how things work, even within their system, even outside their body, and also how they interact with the opposite sex. Everything changes, right? And as it changes, some of them become more daring, some become reserved, shy because of the changes that is happening around them. And at that point, some of them would have to make some decision that would actually impact the future, but because at that age, they don't really have the right information to make that kind of decision. They resort to talking to maybe an older adult who they trust and all, understand. So they begin to think critically and deeply. And when they begin to talk with some of their peers, the adults, and that is when peer pressure comes in, because sometimes for girls at that age, they're conscious of their bodies, they make sure they go out well dressed, they make up, and because of the peer influence, a lot of girls want to become someone else who they are not. And some of these girls, they start having boyfriends, they start mingling with the opposite sex and all, and also navigating relationships, pressure from friends, from family, and everybody. And because this is a unique stage, it's important that they get the relevant information and how to access services. And this is where our work comes in, because we're all advocates. Some of us are experts. Some of us have been doing this work for a long time. We interact with adolescents in rural communities, in urban communities, out of school adolescents, in school adolescents. And we know that in all of this, there are diversity, right? Their needs differ. And it's important that for us to be able to provide tailor-made intervention, we also need to understand this adolescent, right? And they also need to trust us to give them the right information that they would use to make informed decisions about their bodies, about their futures, and everything. All right. So like I mentioned, understanding adolescent needs is really key, because you're providing services or giving information, coming up with innovative solution for adolescents, and you don't even understand their need. You don't even understand where they are in their stage. You don't even understand if they are dealing with a body image issue, or if they're experiencing low self-esteem, or they're already confident to share certain information with you as the advocate. So it is important, because knowing their needs will help us to, provide the kind of strategies, the kind of interventions that would make sure that they get the right and relevant information that they need. So understanding their need is really crucial. Next is, someone mentioned use-friendly services. Of course, this is one of the strategies that we as experts in the field, as advocates in the field, these are the strategies that we need to equip ourselves in order to promote safe and healthy environments for adolescents to thrive, to also promote an healthy sexual behavior among young people, right? Either we like it or not, adolescent young people, they are having sex, yeah, and some of them, they have no information. They don't even know where to access services, where to access information. And because of that, that has increased teenage pregnancy, unsafe abortion, high mortality rate, a whole lot of issues, public health issues that affect adolescents and young people. So, as healthcare providers, as professionals, it's important for us to, know these strategies. And one is providing youth-friendly services. Sometimes we often think that youth-friendly services are supposed to be provided in the facility. No, youth-friendly services generally are supposed to be provided by every healthcare professional, by every NGO worker, by every SRHR advocate, by every peer educator who is providing information, who is providing access for these young people. And in order to make sure that the environment is safe, and let us make sure that they are able to gain the relevant knowledge that we are passing across to them, the information and the kind of services that we are providing, right, should be accessible in youth-friendly locations and ensure confidentialities to encourage young people to seek help without fear, right? So now, for example, we go into local communities to maybe for a neighborhood campaign, talk about contraceptives, talk about family planning, condom use, and all for these young adolescents in that particular community. So it's also important for us to understand the kind of community where they live, right? And also to understand the kind of information they want and in the environment that they want it in. You understand? So where you go to community schools now and you're talking about these access to sexual health and all, some of the people there might be shy to even speak or to even ask questions because their teachers are there. You understand? But if you make that environment safe for the adolescent, maybe by asking the teachers to just go somewhere and have safe space with the adolescent, if it's by dividing them into two groups, female only, male only. So you putting their needs into consideration because an average adolescent is shy. I was shy when I was an adolescent, you understand? Because even to walk into a pharmacy to buy menstrual pads was like an issue for me while growing up because of that environment, because there was no enabling environment for that. You just walk into the store and just go straight and pick it up and pay and go, because we feel that everybody in that knows that this girl is already menstruating. You understand? So that stigmatization, it was there, and giving out this kind of information, it has to be in a safe place where the safety of the adolescent is taken into consideration. And we don't just provide every information for adolescents, right? I don't know if we are conversant with our comprehensive sexuality education manual. The manual provides age-appropriate sexual health information for adolescents and young people. And so if you are dealing with adolescents who are maybe from 17 to 19 years, the kind of information you give them will be different from the one that you give the ones from 10 to 15 years old, right? So segregating information is key, is really vital, because you can't talk about consent, you can't talk about consent with a 10-year-old girl, because at that point she won't be able to process that kind of information, right? But for adolescents between 15, 16, 17 years to 19 years, they should understand that consent is key, because when they start mingling with the opposite sex without having the right information, they tend to make mistakes that they don't even know that it's a mistake, right? That is when we talk about consent, how to negotiate safe sex, how to abstain if possible, and where to access commodities like condoms, like pills, and all. So it's important that we're able to, understand what the manual means and also use that approach. You use that approach to provide the kind of information and services for adolescents, right? And also, sometimes we often forget about other aspects of adolescent, right? Because it's sexual and reproductive health. We most time focus on a sexual and reproductive aspects of their health. But adolescents as a whole, their health, their total well-being in all its entirety matters a lot, right? Some of them suffer mental health issues and also have issues, they have body image issues, low self-esteem. And that is why even the comprehensive sexuality education provides life planning information for young people, right? It covers every aspect, their mental health, physical health, their sexual health, their reproductive health, and all, right? Because sometimes most adolescents, it might surprise, when you understand their needs, it might not even be the sexual aspect, might be the mental aspect. So when we are addressing sexual health, we should also incorporate other aspects of adolescent because they all make up who an adolescent is. Because if they don't have a stable mental health, they won't be able to think well, to actually make the kind of choices that it's relevant and important for them. All right. And one of the strategies also as providers, we should also build healthy relationships with the adolescents and young people that we work with. Like I mentioned that some of the adolescents are in rural communities, in urban settings, and the kind of information, the kind of approach we would use would be slightly different because their needs differ. And as their needs differ, we need to approach it from that lens, right? And make sure that the kind of intervention we're giving them is what they need. And that's how we can be able to measure the impact. That's how we're going to see the results, right? Because maybe in community A, there are a lot of sexually active adolescents, right? So the information you will give, there will be quite different from the adolescents in community B who are maybe for religious issue, for religious purpose and societal reasons, they are abstaining from sexual relationships, right? So we need to weigh and also know the kind of information, the kind of strategies that we will employ on the field, right? So okay, so I'm going to do a pause check. Are we following? I want to hear eyes, hello, and all. It feels like as if I'm talking to myself.
We are following.
Oh, okay. Okay, perfect.
All right. So sorry to Madam Lydia, you have some few minutes left, a very, very short minute left. So
Okay.
please just wrap up with everything. I sent you a message on Zoom.
Okay. Thank you for the reminder. I would just try as much as possible to finish everything in 5 minutes. Yeah. So like I said, building healthy relationship, communication skills, make sure you provide environment that is trustworthy and also respect the adolescent, right? And they would in turn respect because if there's no share lessons learned, and that way you move forward with what you have learned, copy their mode, their intervention, what has worked, right? And that is what is really important in the field. And also leverage platforms like Twitter, which is now X, LinkedIn, Instagram, and I forgot to add one, TikTok. These days, TikTok has like a crazy algorithm, and there are lots of adolescents on TikTok. You understand? So reaching out to them on this social media platform by providing the relevant information, it shows that they can access information anywhere, you understand? So leveraging platforms like social media would help to amplify our voice, we amplify our messaging, we amplify our information, because young people are there, adolescents are there, so we would go to where the adolescents are. We don't expect them to come. Most of them don't even know that they need this kind of information, right? So we will go to where adolescents are. And also, second is partnership building. Partner with organizations. Young individuals like you and I wouldn't work with reputable, maybe the so-called big organizations, right? Partner with local organizations in your community. Join their campaigns, join their voice, lend your voice to the cause, because whatever we are doing, we are lending it to one cause, which is providing access, which is providing services, which is reducing teenage pregnancy, which is reducing mortality rate, like reducing a whole lot of this and amplifying issues that adolescents young people face, right? And we can in Abuja do my own advocacy. No, I mean, so that our advocacy can be strengthened and reach a broader audience, right? Also engage stakeholders. You can't provide information for an adolescent when the parents are against it, right? So it's important for us to involve local leaders, policies, and also policymakers, and also healthcare providers, right, to discuss and find a way to provide SRHR information, and also to strengthen our advocacy, because sometimes if you don't involve the stakeholders, right, your advocacy won't fly at all, because we also need and also convince them to see the need in what we are doing, to believe in this outcome, because they are also the girls in that community are their kids, and their sisters, their siblings, their brothers, and everything. So it's important to carry the stakeholders along in every community. They were conducting outreaches, any community, they were conducting campaigns, targeted campaigns, in school sensitization. It's important to map out the stakeholders in that community, right? Who would support the advocacy, one who would be against this advocacy, and they would come up with strategies in developing an advocacy toolkit, right, that will speak to different stakeholders and also the adolescents in question. The third one is collaborate, join campaigns, work with partners, work with stakeholders, work with everybody, who are raising awareness on SRHR issues, right? And, when there are joint voices, right, it tends to resonate more, it tends to vibrate more, it tends to go faster, and it tends to go louder, right? And also it's important to share resources. Make sure you learn from people, share resources as much as possible, look for mentors, mentor young people as well, and also read, research. There are a lot of information out there, a lot of organizations doing what we want to do. And as young people, it's important that people should know us for the cause that we're championing, so that by the time they mention SRHR, they know that, Dr. Busayo is there, Bukumi is there, right? So it is good to, gain relevant knowledge, information, and also collaborate. Like I mentioned, we don't work in silos. We don't work independently. We don't work in, we can't solve the world's problem. No, we can't solve the a problem that adolescents face in community A alone. No, we can't do it because one, we don't even have the resources. You understand? Two, we don't even have the technical skills. We don't even have the manpower, right? But when we collaborate with organizations, when we collaborate with individuals, when we collaborate with youth group, right, it gives us more structure. It gives us more resources. Resources not in terms of money, no, in terms of skills, in terms of the materials that we're giving out, in terms of expertise and all, right? So, like I mentioned, it's important to collaborate, partner, and that way put our messaging out there, we put our voices out there. And when we put all the messages and amplify our voices out there, right? Other SRHR experts, professionals, advocates also collectively join in the campaign, right? And we are addressing issues that adolescents face regarding their sexual health, regarding their reproductive health, and also regarding every aspect of their body entirely. And thank you so much for listening, for joining in. we really had a short time, but I hope that we're able to grab one or two. And if you have any questions, I am here to answer all your questions best to my knowledge. And feel free to connect with me. This is my email, and you can also reach out to me on LinkedIn. And I've already shared my slide with the organizers, and they would in turn share the slides with you. And I'm here for any questions. If you have any questions, please shoot. I'm here to answer your questions. Okay, it's quiet in here.
So much. Sorry. Thank you so much, Lydia. Apparently, at least the persons that paid for the master class, they paid recording actually for that's what they paid for.
Oh,
Because
okay.
most of they were like they have events, so many persons actually, at least 2 to 3 persons actually paid
Oh,
for the live recording. That's why there is some sort of little to no engagement. And as we want to as much as possible, I didn't want to postpone the master class. And I think this is one of the way of showing up, even if it's 3 to 4 persons that were able to join. Because those persons who actually paid, they were the first persons to come in, and they were because of NYSC and all of those things. So they were like they are in camp. They might not be active in participation, but they will surely want the recording. That's why we're big on that. But I have a question actually. Thank you so much for hosting us perfectly. And I know this is the work of our moderator, but I actually enjoyed of when you talk about, I think the first 2 slides about how to interact with adolescents, and communicating our information in a way that they could break it down and understand. I understand that there are some, like you said something about, we can't, it's 2 points I actually have. One was about consent for younger girls or boys that are below 10 years. And I just want to hear your perspective as an adolescent.
Okay.
Sexual and reproductive health rights. And at this age when everybody's in Gen Z, Gen Alpha, and everybody wants to just explore different part of their sexuality. And I'm just in between, because you mentioned something about an age group like adolescent, that the teaching of concepts at least starts from age, I think 13. You mentioned 13, and then I was like, what about the younger ones, like less than 10, like let's say 9? Should that even be in context, or do you think, like, if a young 9-year-old girl or even 8 come up to me and ask me during my advocacy journey that, okay, I want to start having sex, and like, how will I deal with that? Like, and the person is requesting that, and asking that he is whatever boyfriend or girlfriend they are doing to ask for consent. How do you want to discourage that kind of person? Do you think I should even advise about talking about consent, as it is being said that consent is at least from 12, like before, I think 13? Like, I just have that. I don't know if you clearly get what I'm saying.
Yes, I totally get what you're saying. Yeah, to before I answer your question, right? Because your young girls, like maybe like 8 to 15, sorry, 8 to maybe 10, 11 years old, right? At least you understand. And as they're learning the part of their bodies, it's also important to tell them their private parts. You understand. So that way, we also enlighten them, educating them that because children, either we like it or not, are also vulnerable to gender-based violence. They're also vulnerable to sexual violence. You understand? Yeah. So at that age, if you're teaching them about their bodies, put it in a context, mentioning the name, telling that okay, for female, it's vagina, it's not bum bum. For men, for boys, it's penis, it's not kuli kuli, or sorry, or how they say it in the local context, right? So at that age, if they understand this, right, and the way we break it out to them, and they would go out and somebody would just spank their pop and they'd be like, don't ever do that. You get, because they know that it is wrong. And that way they are even encouraging them to speak up, to speak out. You understand? So because children can be clueless sometimes, you understand, but at that particular age, you're teaching them that you're not teaching them consent, but you're teaching them life skills. You understand? Yeah, and if it's 8 years old girl comes up to me and starts talking about boyfriend, and wanting to have sex and what, right? It's also important to sit her down and understand where she's coming from. Children of these days are exposed to a lot of things they see on adult phones, the things they watch on TVs. I know kids don't forget, right? So it's important to, when they start talking about boyfriends, okay, so who's talking about boyfriends, seeing or she too, she wants for age to have a boyfriend is 18 years, because that's where they become an adult and no longer minors, right? So it gives them the implication, right? The consequences, because at that age the consequences are more, right? So you break it down, give them the consequences, what has happened to what happens in relationship, as not the way you'd break it down to someone who is 15 years old, right? Because he's about to ask questions, and it's important to provide the right information for them, but depending on how we put it in context for them, right? So you tell them that a 8 years old girl is not supposed to be in a relationship, right? You're not supposed to be thinking of having a boyfriend, because you're supposed to be thinking of reading, understanding other aspects of your body, and also, enjoy the moment, enjoy being a child, you understand? So having that kind of conversation, they come to you because they trust. And any information you give to them at that point, they would believe. If you give them the wrong information, trust me, they will grow up with that wrong information. But if you give them the right information, right, they're able to discern, and they're able to make the choices. If you look at it, for example, I don't know for others, but for me, while growing up, I was so scared of my teachers in school, because I believed that they were like the alpha and the omega back then. Because if you misbehave, they punish you. We spend the better part of our days in school, right? From 8 to 4 p.m. You come back home, you do assignments, you have little time to even discuss with your parents. The next thing, you eat dinner, and then you go to bed. You understand? So at that point, anything if the teacher has said the sky is yellow, we all believe that the sky is yellow, because one, we've put some certain trust in the teacher, right? So if you're working with adults, it's important to build that trust so that they can come out and openly ask questions, and they will provide the information in the right context. A 8 years old child, boy or girl, does not have business be in a relationship, right? They only need to, understand their body, their part, and also, at that point, also tell them that gender-based violence happens to everyone. You get, and they will also need to get that kind of information when when a male teacher asks them to come into his office, they don't understand. They also need to like read the triggers and all, right? So a 8 years old girl does not have business having a boyfriend or thinking about having sexual relationships rather. So understanding their needs, where that is coming from, will help to address the issues. I don't know if I've answered your question.
Yes, you did actually. Like that was very well answered. So I'm able to get
Okay.
it because I'm not so. I have to tell them that focus on something else because the issue of having boyfriend or even consent is not. Consent can be in two contexts. I think that's what I learned from this discussion.
Yeah.
That's okay. Consent in the form of your body knowing the names of what it is about your body for younger girls or boys in younger girls and boys that okay these informations about your body when person wants to like touch you or do some stuff with you is not in them to for them to ask for consent, right? But for you to let them know that it's not even an issue of consent, is a no at all times,
Exactly. If you
and
know.
then letting them know that at this age is not the time to think about a sexual relationship or even having any form of sexual engagement because their body is still growing, and then they should focus on the right thing, learning about themselves, learning about their mental health. I think I got that. Thank you so much.
Okay. You're welcome. And I don't know if you have access to any comprehensive sexuality education manual.
Yeah, I do, but it's on
Okay.
global health learning.
Oh, it's on Global Health, right? Because if you, I think there's one
Okay,
on.
I
Okay.
think we spent a lot of time. We've I'm so sorry to cut you off, Dr. Busayo and Madam Jumai. I'm so sorry, but
Call me
our time
Lydia,
is
please.
fast.
Just call me Lydia. I'm not in
Okay,
matter.
Lydia.
Just call
All
me
right, our
Lydia.
time is
Yeah.
fast spent, and we are keeping to time.
Okay.
And so far, I know that Dr. Busayo really you know, really want to understand the in-depth of adolescence and how and a person that is just growing up can have knowledge and awareness on what to do, on how to navigate through with that growth, with hormones and every other thing. I know that you can also have that conversation behind this class. And well, I don't know. And Bisayo, Dr. Bisayo, if you can hear me, you can hold your mic and
All
say
right,
hello.
yeah, yeah.
All right, okay. I don't know, maybe you have any other thing to say. I'm so sorry I cut you off right there. I
No, it's
was
fine.
just trying to manage the whole time because we're
All right,
working with time. Before
all right,
Zoom comes out again, it shouldn't, it won't be very nice.
all right. It's
Um,
okay.
all right. How about Dr. Jumai? If you have one or two things to say in conclusion, so we can wrap up. We can call it a wrap.
Okay, thank you, and thank you for calling me doctor. I am not a doctor. Maybe in the near future, maybe years from now, I might become a PhD holder, which I don't know, but the doctor is for Busayo. Thank you so much,
Honorary
Busayo,
doctor
and
is possible.
thank you so much for inviting me. And I really had fun, taking this topic, and hopefully we would work together more in the future. And thank you so much. I do not have anything to say, rather than say thank you all, and I wish you a wonderful master class up until the end of February. And do enjoy your weekends. Thank you so
All
much.
right. Thank you for having us and thank you for that rich, as in your, let me comment on your slide. your slide is so explanatory and so imaginable. I love the fact that you put a pictorial way of imbibing the information to the people, even the young ones. So it's not about I was actually expecting a very comprehensive slide, not expecting something very simpler that even a teenager, 12-year-old, 10 years old, they can easily comprehend and understand what the slide is saying. I really need to commend you on that, and how you were able to carry us along. It's really one side of you that I so much love, the pause and putting us through on step by step on what to know, like just prepping us before the class. I really I really appreciate that. And of course, thank you for having us and thank you for this lecture. It's really a very intellectual one. And of course, we're wishing you and can't wait for you to be a doctor in the next 5 years time. Of course. I can't wait to call you a doctor, Dr. Jumai. I think I would just Dr. Jumai is very okay by me. Yeah.
Thank you so much. Thank you for
Permit
your
me to
kind
use
words.
that word.
Thank you.
Yeah,
It's
yeah, yeah.
fine, it's fine. Doctor, we
All
said it's
right.
an honorable doctor. So thank you so much. Thank you. So I beg to take my leave now.
All right, okay. Bye.